Artificial Intelligence Doctor. User question. When is an AVEIR AR atrial leadless pacemaker necessary in a patient with an AVEIR VR ventricular leadless pacemaker? Claude AI answer. Let me help explain when dual-chamber leadless pacing with AVEIR AR atrial and VR ventricular would be considered. An AVEIR AR atrial leadless pacemaker would be considered for addition in a patient who already has an AVEIR VR ventricular leadless pacemaker when 1. The patient develops symptoms or signs of chronotropic incompetence, inability to appropriately increase heart rate with activity, that cannot be adequately managed by the ventricular device alone. 2. The patient develops significant AV desynchrony or timing issues between atrial and ventricular contractions that could be improved with coordinated dual-chamber pacing. 3. Evidence emerges of pacemaker syndrome, symptoms related to loss of AV synchrony, such as fatigue, dizziness, exercise intolerance, shortness of breath, neck pulsations, blood pressure drops with pacing. 4. The patient's underlying rhythm requires more sophisticated sensing and pacing capabilities than what the single-chamber ventricular device can provide. 5. When optimization of cardiac output through AV synchrony becomes clinically important, particularly in patients with heart failure symptoms, reduced exercise tolerance, hemodynamic compromise. The decision typically involves careful evaluation of symptoms, underlying rhythm, hemodynamics, and quality of life impacts to determine if the benefits of adding the atrial component outweigh the risks of an additional procedure. Would you like me to elaborate on any of these specific indications or discuss the technical aspects of how the two devices communicate and coordinate their function?